When it comes to men's health, few topics are as essential and often overlooked as prostate care. Most men are surprised to learn just how much their daily habits can impact the health of this small but powerful gland. With prostate enlargement affecting millions worldwide, maintaining prostate wellness goes far beyond comfort. It's about ensuring a higher quality of life as the years go by. Before diving in, here's a fact that might catch you off guard. Over 50% of men above the age of 50 develop symptoms of benign prostatic hyperplasia, or BPH. That number jumps to 80% by age 80, making prostate enlargement one of the most common health concerns men will face. But the good news? Many of the risk factors are within your control, starting with what you do today. I'm Dr. Isabel Lopez, a urologist and specialist in men's health with over 25 years of experience. And where are you watching from? Drop it in the comments, and stick around because I have a surprise for you at the end. This video is designed to cut through the confusion and give you clear, evidence-based strategies to keep your prostate healthy for the long haul. Whether you've just turned 50 or you're already keeping an eye on your numbers, every man can benefit from the simple, proven steps we'll cover. From nutrition to exercise to regular checkups, we'll break down exactly what works and what doesn't, based on the latest scientific research. You'll also learn how your family history and hormonal balance play a direct role in your prostate's future, plus what early warning signs to never ignore. By the end of this guide, you'll have a practical action plan to prevent BPH and safeguard your health moving forward. If you want to stay ahead and support your well-being, follow the channel so you don't miss any crucial tips. Now, let's uncover the root of the problem and why the prostate plays such a critical role in men's lives. The prostate is a small, walnut-sized gland located just below the bladder in men. Its main function is to produce seminal fluid, which nourishes and transports sperm during ejaculation. Though it may seem minor, the prostate plays a vital role in fertility and overall urinary health, serving as a key component in the male reproductive system. Benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate that tends to occur as men age. This condition doesn't mean you have cancer, but it can dramatically impact daily life. The growth of the prostate squeezes the urethra, the tube through which urine passes, making urination increasingly difficult and sometimes uncomfortable. The exact cause of BPH isn't fully understood, but hormonal changes over time are a major factor. As men get older, the balance between testosterone and a hormone called dihydrotestosterone, DHT, shifts, triggering the prostate to grow. Family history and lifestyle choices can further increase the risk, making prevention a lifelong process. Symptoms of prostate enlargement often begin subtly but can quickly escalate. Common signs include a weak urine stream, frequent trips to the bathroom, especially at night, difficulty starting or stopping urination, and a constant feeling that the bladder isn't fully emptied. Ignoring these signals can lead to further complications down the road. Left unchecked, BPH can cause more serious issues such as urinary tract infections, bladder stones, and even kidney damage. That's why understanding your prostate and recognizing changes early on is essential. Paying attention to these symptoms isn't just about comfort. It's a critical step in safeguarding your long-term health. With this foundation, it becomes clear why men need to be proactive about prostate wellness. But beyond the basics, one question remains. Could your risk be determined even before you're born? In the next segment, we'll explore how genetics and family history shape your prostate's future. Genetics play a much larger role in prostate health than most men realize. If you have a father or brother who has experienced prostate enlargement or related issues, your own risk of developing BPH can be significantly higher. Family history is a crucial piece of the puzzle, influencing not only if, but also when symptoms might appear. Research shows that men with a close relative affected by BPH are up to 4 times more likely to encounter the same problem themselves. This heightened risk isn't just about shared habits. It's built into your DNA. The genetic blueprint you inherit can set the stage for how your prostate responds to aging, hormonal changes, and environmental triggers. Certain groups face even greater risk. African American men, for example, tend to develop prostate issues earlier and more aggressively than other populations. Meanwhile, men with multiple affected relatives, especially those diagnosed at a younger age, should be extra vigilant. Recognizing these patterns early can make all the difference in prevention. Understanding your family history isn't just informative, it's empowering. Sharing this information with your doctor allows for more personalized care and earlier interventions. A detailed family background can help your healthcare provider recommend the right screenings and lifestyle adjustments tailored specifically to your risk level. Proactive steps, like maintaining a healthy diet and scheduling regular checkups, become even more important when there's a genetic predisposition. If you're unsure about your family's medical history, now is the time to start those conversations. The more you know, the better prepared you'll be to protect your health. Still, even with a strong genetic link, you're not destined to develop BPH. The story doesn't end with your DNA. What really tips the scales? In the next segment, we'll uncover how hormones interact with your genes to influence prostate growth over a lifetime. Hormones are the silent architects of prostate health, quietly shaping the gland's size and function throughout a man's life. Two key players dominate this scene: testosterone, the principal male hormone, and dihydrotestosterone, DHT, a more potent derivative. The conversion of testosterone into DHT is controlled by an enzyme called 5-alpha reductase, which becomes increasingly important as men age. As years go by, even small shifts in these hormone levels can have a profound effect on the prostate. Higher levels of DHT cause the gland to grow, while a decrease in testosterone's protective effect makes the prostate more vulnerable to enlargement. It's this subtle hormonal dance that often triggers the first signs of BPH, long before symptoms appear. But hormones don't act in isolation. Genetics, lifestyle, and even medications can influence how these chemical messengers operate. For instance, men with a family history of prostate issues may experience more pronounced hormonal shifts, accelerating the growth process. Understanding this interplay is crucial for anyone hoping to prevent or delay the onset of BPH. Some men consider hormone-modulating therapies, but these are not a one-size-fits-all solution. Such treatments must always be discussed with a healthcare provider to avoid unintended side effects. The right approach depends on individual risk factors, medical history, and lifestyle, making personalization key in any prevention plan. Staying informed about hormonal changes and maintaining regular communication with your doctor can help catch problems early. This knowledge equips you to make smarter choices regarding diet, exercise, and medication, all of which can help maintain a healthy hormonal balance. Now, while hormones are a critical factor, they are not the only piece of the puzzle. Other conditions that affect your whole body can also have a direct impact on prostate health. Join the Members Club and leave a super like, because up next, we'll reveal how metabolic syndrome and chronic diseases influence your risk of BPH. Metabolic syndrome, a cluster of conditions including diabetes, hypertension, and obesity, has a far-reaching impact on men's health, especially when it comes to the prostate. Studies show that men dealing with these conditions are at a much higher risk for developing BPH. It's not just about the numbers on the scale or your blood pressure reading. It's about how these factors silently drive inflammation and hormonal imbalance in the body. Excess glucose and cholesterol levels contribute to chronic low-grade inflammation, which can promote abnormal cell growth in the prostate. This means that men with poorly managed blood sugar or high cholesterol are often unknowingly fueling the very process that leads to prostate enlargement. The link between metabolic health and BPH is stronger than most people realize. Scientific research backs this up. One major study found that men with metabolic syndrome had a 70% higher risk of BPH symptoms compared to those with healthier metabolic profiles. The interplay between high blood pressure, excess body fat, and insulin resistance creates a fertile ground for prostate problems to take root and progress. Understanding this relationship is empowering because it offers a clear path for prevention. By taking steps to manage weight, control blood pressure, and regulate blood sugar, men can significantly reduce their odds of experiencing prostate enlargement. Lifestyle changes have a real, measurable impact, often more powerful than medication alone. This is why doctors now view prostate health and metabolic health as two sides of the same coin. Improving one almost always benefits the other. Small adjustments in daily habits can yield lasting protection, making it possible to break the cycle before it starts. But knowing what to avoid is only half the battle. What about the foods that can actively protect your prostate and promote overall wellness? In the next segment, we'll break down exactly what to eat and what to skip to keep your prostate in top shape. A balanced diet is one of the most powerful tools for maintaining prostate health and preventing enlargement. Countless studies highlight the Mediterranean-style diet as especially protective. This approach centers on fresh vegetables, fruits, whole grains, healthy fats like olive oil, and moderate amounts of fish and poultry. Such foods supply antioxidants and anti-inflammatory compounds that help keep the prostate in check. Among protective foods, tomatoes stand out due to their high lycopene content. Lycopene is a potent antioxidant shown to reduce the risk of prostate problems. Eating tomatoes, cooked, raw, or in sauces, can deliver real benefits. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts are also packed with nutrients that support cellular health and lower inflammation. On the flip side, certain foods are best limited or avoided. Diets high in saturated fats, red and processed meats, and excess dairy have been linked to increased BPH risk. These foods can promote inflammation and hormonal imbalances, making prostate symptoms worse over time. Swapping out these risk foods for plant-based options can make a noticeable difference. Practical daily choices matter. For breakfast, opt for oatmeal with berries and nuts. Lunch could include a colorful salad with grilled salmon, while dinner might feature whole grain pasta with tomato sauce and a side of steamed broccoli. Snacking on fruits, seeds, and a handful of walnuts further boosts protective nutrients. Adopting these habits isn't about perfection. It's about consistency. Even small, gradual changes can lead to significant improvements in prostate health over the years. Tracking meals or working with a nutritionist can help reinforce positive patterns and provide ongoing support. But diet is only one pillar of prevention. What you do outside the kitchen, how you move your body, can be just as impactful. Up next, discover which types of physical activity can further reduce your risk and why staying active is essential for long-term prostate wellness. Regular physical activity is a cornerstone of prostate health and a key factor in preventing enlargement. Research consistently shows that men who stay active have a lower risk of BPH and experience fewer urinary symptoms as they age. The benefits aren't limited to athletes. Simple, consistent movement can make a profound difference over time. Walking is one of the most accessible and effective forms of exercise for men of all ages. Just 30 minutes of brisk walking 5 times a week has been linked to improved prostate health and a marked reduction in BPH symptoms. Moderate activities like cycling, swimming, or even gardening can provide similar rewards, keeping the body and prostate functioning smoothly. Aerobic exercise is especially powerful for reducing inflammation and improving blood flow. These effects not only support prostate wellness but also benefit the heart and metabolic system. Studies have found that men who engage in regular aerobic activity are up to 25% less likely to develop significant prostate enlargement. The key isn't high intensity, but consistency. Gentle, regular exercise lowers inflammation and supports hormone balance, both critical for prostate health. Even small daily efforts, taking the stairs, stretching, or adding extra steps, add up over time, contributing to long-term wellness. Many men worry that it's too late to start, but research suggests benefits begin as soon as you become more active, regardless of age. The goal is to find activities you enjoy and build them into your routine, making movement a natural and enjoyable part of your day. Physical activity is a powerful preventive tool, but it's important to be mindful of medications and substances that could undermine your progress. In the next segment, you'll learn which common medications might worsen urinary symptoms and what steps to take for safer management. Many men are surprised to learn that some common medications can actually worsen urinary symptoms associated with prostate enlargement. Over-the-counter antihistamines, decongestants, and tricyclic antidepressants are among the main culprits. These drugs can tighten the muscles around the urethra or reduce bladder contractility, making it even harder to urinate when the prostate is enlarged. Antihistamines, often used for allergies, and decongestants, commonly found in cold remedies, may seem harmless but can have unintended side effects for men with BPH. They work by blocking certain signals in the body, which, in turn, can interfere with the natural flow of urine. Men already dealing with prostate symptoms might notice increased urgency, incomplete emptying, or difficulty starting urination after taking these medications. Tricyclic antidepressants, prescribed for mood disorders and sometimes for chronic pain, can also impact urinary function. They may relax the bladder muscles too much or affect nerve signals involved in urination. This can lead to retention and even higher risk of urinary tract infections, especially for older adults. It's important to never start or stop any medication without consulting your doctor. A healthcare provider can help identify safer alternatives or adjust dosages to minimize urinary complications. Open communication about all the drugs and supplements you use, including herbal remedies, is essential for preventing problems. For men managing multiple health conditions, regular medication reviews are a must. Bringing a full list of prescriptions and over-the-counter products to every doctor's appointment ensures that nothing is overlooked. This proactive approach can help you avoid unnecessary side effects and protect your prostate health. But even with careful medication management, nothing replaces the value of ongoing medical supervision. Next, discover which preventive exams every man should prioritize and how regular checkups can make all the difference for long-term wellness. Consistent medical monitoring is the backbone of effective prostate health management. Regular checkups with a urologist are not just a precaution, they are essential for early detection and intervention. Many prostate problems, including BPH, can progress silently, so relying on symptoms alone is rarely enough. Key screening exams should become routine for men, especially after age 50 or earlier for those with risk factors. The PSA blood test, which measures prostate-specific antigen levels, is widely used to identify potential issues early on. Elevated PSA doesn't always mean cancer, but it does signal that further investigation is needed. Pairing this test with a digital rectal exam gives doctors a fuller picture of prostate size and texture. Ultrasound exams may also be recommended to assess prostate volume and detect structural changes. This non-invasive imaging technique helps doctors catch problems that aren't yet causing symptoms. The combination of these exams enables a proactive, tailored approach to each patient's needs. Knowing when to seek medical help is crucial. Sudden changes in urinary habits, blood in urine, or persistent discomfort should always prompt a visit to your healthcare provider. Early intervention can prevent minor issues from becoming major health challenges and may even protect kidney function in the long term. Routine monitoring isn't just about finding problems, it's an opportunity to strengthen your prevention plan. Your doctor can provide personalized advice, track progress, and adjust recommendations based on your evolving health profile. This collaborative approach empowers men to make informed decisions and remain in control of their well-being. Join the Members Club, drop a super like, follow the channel, and leave a comment to show your support. In the final segment, you'll get a clear action plan for daily life and a motivational message to keep you on track for lasting prostate health. Join the Members Club, drop a super like, follow the channel, and leave a comment if you found these insights valuable. Your engagement helps more men access this crucial information. Let's recap the essential steps for protecting your prostate: understanding your risk factors, maintaining a balanced diet, staying physically active, managing medications, and keeping up with regular checkups. Each of these strategies builds a solid foundation for long-term prostate wellness. Small changes in daily habits can yield powerful results. Swapping processed foods for colorful fruits and vegetables, taking a brisk walk each day, and having open conversations with your doctor are all investments in your future health. Prevention is not about perfection. It's about consistency and the willingness to prioritize yourself. Remember, your genetic background and hormonal balance matter, but they do not define your destiny. Armed with knowledge, you can take proactive steps to minimize risks, even if BPH runs in your family. Support systems, like this community, make it easier to stay motivated and hold yourself accountable over time. Don't overlook the importance of monitoring. Simple screenings and early discussions with a urologist can reveal issues before they become serious, giving you more options and greater peace of mind. If you're experiencing symptoms, don't wait. Reach out and get the support you deserve. Ultimately, the power to prevent prostate enlargement lies in your hands. Your choices today set the stage for better health tomorrow. Stay informed, stay proactive, and keep making small improvements. Your body will thank you in the years to come. Thank you for watching and being part of this journey. Remember, prevention is a lifelong commitment, and every step you take counts. Stick around for more practical advice, and together, let's redefine what it means to age with strength and confidence.